morning to us all.
Good morning.
I hope by the grace of God we are doing fine.
Yes.
Please, my name is Nurse Shadrach Ankra. You can call me Shadrach. This is a mid-morning show we do, a program we do to talk about general health conditions. We educate ourselves, we learn new things, we take questions from our patients, our clients, and then we work on it. So today, I will just introduce the facilitator. We'll be talking about typhoid fever. And I know we will have one or two questions concerning typhoid fever. If not for us, for our relative, for our friend, or maybe what we have heard in the news, in the society concerning typhoid fever. So without wasting much time, I'll call on the one to lead us, the facilitator, in the person of Nurse Aisha Ejay. Can we do something small for her?
Thank you very much. Good morning, everybody, once again. So as I was rightly introduced to you, my name is Aisha. And for some time now, we've been doing this program for our clients. We realize that when you come, there are a lot of questions that you have for us, but you may not have all the answers. So we present this platform to you as an opportunity where you can ask us questions after I have done my presentation. And then if you have anything beating your mind, hopefully by the end of today, I'll be able to settle all that for you. So as he said, today we are going to talk about typhoid fever. Please, how many of you have heard about typhoid fever? How many of us? Okay. Have you heard of typhoid fever before? You haven't heard of typhoid fever. Okay. So typhoid fever or enteric fever, medical terms, that's what we call it. Now, it's one of the most common conditions that a lot of people talk about. You hear people saying, menya typhoid. Today, I'm here to educate you about typhoid fever and to let you know what you don't know about typhoid fever. So when I went to school, I remember in nursing training, when we did the topic typhoid fever, the teacher said something which stuck with me for the rest of my life up to today. He said that typhoid fever, in simple terms, means that and we're all like, no, how can you say that? He said yes. When you get typhoid fever, what it means is that you have ingested excreta. So the question is, how can I, in my normal sense, go and take excreta? Those who don't know what excreta is, Sebi, wejanai. Yes, when you're typhoid, that is a way janai. I don't think any of us here would go and say that we are taking Sebi, your toilet, but yes, when you're typhoid, says a way the wejanai. So then the question will fly and you'll be asking yourself, how did I end up eating this? So today, my work here is to let you know how you are able to eat that and how you can avoid it. So when you come to medical terms, we say that typhoid is caused by a bacteria called Salmonella typhi, or Salmonella, simple. That's the most common thing that we say. So how do we get Salmonella? Now, most people would say that, as for me, I don't eat outside food, so I don't know why I got the typhoid. I'll give you a typical scenario at home where you go and visit the washroom. You are cooking and then you move from the washroom, you don't wash your hands. And then you come back and you are cooking. Mind you, when you finish using the washroom, you clean yourself with your hand, right? And you could have picked particles from cleaning your hands. So if you don't wash your hands properly with soap, do you realize that you've picked up your excreta? And that is how you can introduce it into the food that you are cooking. So most people, when they are diagnosed with typhoid, they always say, but I don't eat outside food. Oh, I'm very careful. I don't even eat outside food. So how am I getting this? This is where you are getting it from. And you can also get it from water that you drink. Oh, but I don't drink tap water. I am always taking bottled water or sachet water. Do you know where that sachet water is coming from? Do you know how they manufacture it? Even the bottled water, do you know how it is kept by the person you bought from? So these are ways that we get. And I know some of us here, we also like to eat wache, the one by the gutter and the public toilets. A hona taste no one. Tell me I'm lying. Most people, when they are sending you to buy wache, they'll give you a specific direction. I like the watch that is by the gutter because they say gutter no man is a flavor. So these are the little ways that sometimes you get it. Now, what are the signs and symptoms of typhoid if you get typhoid? In medical practice, most signs and symptoms look familiar. One of the commonest signs and symptoms that will separate typhoid fever from any other fever condition is a rash. So sometimes when you are getting typhoid, one of the things that you look out for, you see there will be a rash on your skin. Sometimes you say, oh, it's heat rashes. It will be at your back, and then sometimes in extreme cases on your face. But usually you see it on your hands and then your back, and then sometimes on your chest area. So these are some of the things that when you see, you should be fast enough to know that no, there's something coming up. And more especially with children, because now most of us have children who go to school and they eat from the school. We cannot be 100% sure where the food is being prepared or how it is being served to them. So these are some of the things that we are expecting that you look out for. Another thing is also that you have joint pains. So sometimes when people have typhoid fever, they even come and tell us, me want malaria. Me want malaria. Me hunam yina me joints me want malaria. Typhoid fever can give you that. Another thing too is that you feel very tired easily. Very, very tired. The least thing you do, you are tired. Then also there is that cardinal sign that comes with typhoid fever. You can't miss this one. Headache. Severe headache. You can't even keep your head straight. When you see some of these things, please be aware that you are developing typhoid fever. So somebody would ask, how do I avoid getting this? From what I said from the beginning, it is obvious that if you are not a hygienic person, you are likely to get typhoid. So from our homes, what do? First of all, there was this advert that they were doing with Huhu and Sunday seminar. Please practice it at home. When you practice it at home, it becomes part of you. For us nurses, everything that we do, we wash our hands. We wash our hands every day. But sometimes in our homes, we overlook. Somebody will use the washroom and then come out and do this. Yeah, I'm guilty, so. You do it. The man is laughing at me. You go to the washroom and instead of washing your hands with soap, you just wipe your hands like this. Mind you, soap will not guarantee 100%, but we know that it saves you to a certain degree. So please, let's practice good hand washing techniques. And when the COVID period came, the children picked up this habit of washing their hands. Also, you should be very particular about what you eat and where you eat. So those of us who like the water that is by the gutter, please, let's be mindful that Salmonella typhi comes from poop. So if there is human excreta through the gutter and a fly drops on it and picks it up and you are sitting there eating, or even you are not eating, sometimes you are buying food and you can see flies in the sieve. Please, let's be mindful of some of these things because that is where you can pick it from. So, as you take care of yourself at home, you do the same when you go out. If, like us, you eat from the hospital canteen, make sure that before you are served your food, you wash your hands properly before you eat your food, especially if it is maybe kenke or banku. Because every other exposure that you get increases your chances of getting into a worse state. Some of you may not be aware, but typhoid fever can kill you. We have different stages of typhoid fever. Stage 1, stage 2, stage 3. Have you people realized that sometimes there are people in your houses that you cannot explain what happened to them? Suddenly, you are told this person has gone mad. Typhoid fever can cause that. So if you get repeated episodes of typhoid fever and you are not taking very good care of yourself, you can get into that stage where everybody will think that you suddenly went mad. This is because typhoid fever, the bacteria that causes it affects our liver. And if you don't know, today I'm telling you that the liver is one of the most important organs of the body. It is the sewage system of the body, the liver and the kidney. And typhoid, the bacteria that causes it, usually affects the liver. So when it breaks the liver down, gradually you will get to a state where you will be confused, you will not have coordination, and then at the end of the day, once you don't have these things working for you, then you know you are going down there. Another worse complication from typhoid fever is intestinal perforation. Usually, the salmonella affects the small intestines where digestion takes place. So imagine this bacteria in your intestines. And what it does is it punches hole in your intestines. And your intestine is supposed to be like a tube where digestion happens. So imagine if there are holes in it. It means that some of the waste products will get into your abdomen, which is not supposed to be so. So then eventually you are killing yourself gradually. This is the reason why I would want to emphasize today that when you are diagnosed with typhoid fever, please do well to complete your antibiotic therapy that you are given. Because at the end of the day, when you start the treatment and you break in the middle of treatment, it will definitely affect you. The bacteria is supposed to be conquered within a particular number of days. Let's say, for example, we give you the tablet to take for 7 days. By the 4th day, you should be feeling better. So if by the 4th day you decide that, oh, because I'm feeling better, I'm not going to take my drugs, and then you decide to stop taking it, what you've done is that you have stopped the process of eliminating the bacteria from your system. And so maybe you were cutting from the legs, you got to the chest area and you felt better, you decided that, let me just stop taking this medication. What those bacteria do is that they mutate. They can easily form legs again. And this time, because they know that you are likely to go back and bring medication, they will form into a stronger version of what they were. So maybe if we were using drug A to treat your first condition, this time when you come, we have to use drug A plus drug B. Because now it has gone to build. The first time, it wasn't aware that you were going to attack it, so it didn't come prepared. But this time, it will prepare for you. So typhoid, typhoid. We don't take it serious. But I beg you, today I'm here not to scare you, but to educate you on the fact that the little things that we ignore goes a long way to affect us. And typhoid too, there's one thing about typhoid. You might come here for the first time and we'll diagnose you with typhoid fever. Usually, the strain still remains in your blood. So, you have what we call carriers. I was first diagnosed with typhoid fever in 2003. But as at now, I am a carrier. So, I may not have typhoid fever, but when they test me for typhoid, they will see it in it. So, we have what we call differential diagnosis. The symptoms of typhoid may look like another condition, but there's always a cardinal symptom that always distinguishes typhoid fever from the others. So you realize that sometimes you come and then you'll be complaining that, oh, maybe I have malaria. But the doctor will tell you that I'm treating you for typhoid. This is because there is a diagnosis that we've done that will separate the symptoms you are having from that of malaria. So with all this said, I want to stand here today and tell you that it is not a condition that we cannot avoid getting. But once you get it, do take the steps to also make sure that you get the cure that you need. We are here to help you. If for any reason or the other you have anything on your mind that you feel that you don't understand, we are here to help you. So today I won't talk much. I'll open the floor. If anybody has any question to ask concerning typhoid fever, or maybe at a point when I was explaining myself, you didn't understand me, kindly let me know and I'll be glad to help you. Thank you all very much. So time for question. Please give the mic to him. He wants to ask us a question. Okay, that's a very beautiful question. Now, he's asking that he has typhoid, but he wants to do herbal medicine preparation. I know about a lot of medical, herbal medicines around that are promoting, oh, when they are typhoid, they do, typhoid, they do. As a medical person, I will not pretend that I know a lot about herbal medicine. But what I can tell you is that as conservative practitioners, we do not rule out the use of herbal medicine, because way before these orthodox medicines came, we were using herbal preparations. Herbal preparations were the thing. But now the problem we are having is that the combination of these two can cause problems for you. Because mind you, when you ingest anything into your system, it is the liver that works on it, all right? So imagine that you are giving the liver the orthodox medicine, which is maybe about 3 drugs. Then you go and add the herbal preparation, which is probably a combination of about 3 or more trees that you put together. You just put yourself in that situation. You realize the burden you are putting on your liver. So we advise that as much as possible, if you are doing orthodox medicine, concentrate on the orthodox medicine. When you are done and you are still not convinced that you are okay, but you still want to go herbal, you are free to go. But we will not stand here and tell you that don't do herbal. Please, it is your belief that also works for you. So if you are doing orthodox, concentrate on the orthodox. Then when you are done, you can do your herbal. Or if it is purely herbal that you want to do, you can go ahead and do it. So long as it is not causing harm to your system. Because one of the things that I discovered, I went to sell briefly at the market and I got exposure to these things. That now what most people do with the herbal preparation is they will sometimes put certain medications in it. So for example, we know that Valium makes people sleep. They will actually dissolve the Valium in the herbal preparation. And they will come and tell you that as for this medicine, when you take it, you will sleep. And because you don't know, you will go for it. Sometimes toxicity happens because the combination of these 2 drugs is producing a reaction which you don't know. For you, the Valium will make you sleep. And because of that, that medicine is working for you. But what is happening in your liver, you don't know. So eventually, we are having a lot of people who are coming up with kidney problems. Because sometimes on your blind side, these people are doing these combinations, which you don't know. So I would usually advise that if it is herbal preparation that you want to do, it should be something that you can vouch for. That I put this and this together to get this. But if it is what you are going to buy, which you cannot guarantee what they put in it, don't combine the two. Just do one at a time. Please, I hope that answers your question. Thank you very much. Any other questions for me? Yes, you have a question. Please give the mic to him. Hello, give the mic to him. Thank you.
Please, my name is Robert.
Yes.
Please, talking about Wache, I'm the victim of Gaza.
Okay.
But I also have typhoid, and the doctor advised that I should stop eating too much of oil. So I don't know whether that one too is true. So I want to be clear over it. Thank you.
That's a beautiful question. So I was actually going to come to that about foods that you should avoid when you have typhoid. Usually fatty foods are one of the things that we do not encourage because the bacteria so if you keep taking in fatty foods, you are actually giving it an environment where it can grow and destroy you further. So usually we don't advise that when you have been diagnosed with typhoid, you should indulge in fatty foods because that's a thriving environment for the bacteria. So your doctor was right when he told you that avoid fatty foods. And even for your own health's sake, you would want to reduce the intake of fat. You understand? So he was right. So I hope you are doing that. Thank you. Is there any other question?
Emmanuel, in your statement, you made mention of you being a career. So can you explain for that to me?
Yes. So when I say you are a career, what it means is that even though you have been cured, you still have certain strains in your bloodstream. So whenever you go for a typhoid test, they will tell you you have typhoid. Yes, you will test positive for the typhoid, but you do not have it actively in your system. It's like, I want to get a palm oil. You pour palm oil into a container, and then you pour out the palm oil. You see, you still have some stain of the palm oil. That is how the bacteria works. So, like he was advised not to take fatty foods. If I, being a carrier, I don't check those things and I keep feeding my system with the environment that will help that bacteria grow. Because mind you, if you are not feeding it, it will not grow. It only thrives in places where it will grow. So, for example, he has been told not to eat fatty foods and he decides he's not going to. So, the stain will be there. So, every time you do a test, we will see that there is a stain in it. But it doesn't mean that you actively have it. That's why I was telling you that, I'll come back to you. That's why I was telling you that there is always a differential diagnosis that helps us to know that it is typhoid that we are dealing with. There is always a differential diagnosis. You're still not too clear about it. So my palm oil, this thing didn't work.
So meaning you being positive and you being a carrier, they are two different things?
Yes.
Okay.
They are two different things. Okay, does that... Yes, ma. That's what the mic in the mind.
Pacho, inti say unya typhoid fever intimi feel mudana.
Okay, so the truth is that esnobia obi wo ho a wo de ye friend say eduro no mana e be clear efi the system. Others too, depending on your blood type. One say esunu nipa bia o. It is in your system te no anya sa na meme system te. That is why we always say that what works for one person may not work for you. And don't say if you have the carrier there, it means that they be our typhoid. And I make sure say you look out for signs and symptoms. Certain I make sure and sometimes, unfortunately, many say I've had it over 20 years ago. Every time I test for typhoid, it is positive. And usually typhoid you're testing for 2 different tests. So there's one particular test. That's that one, if you test positive for it, it means that you're active salmonella newoho. So it is 2. If you get the chance to see your lab results, you will see that when they request for typhoid, it is 2. One is IgM and then I think one is IgC or so. One of them, if it shows positive, I know dear, typhoid. But the other one, if it shows positive, it is just the carrier that we are seeing there, the carrier presence that we are seeing there. So I'm just trying to explain it in layman's terms for you. Etima, depending on obi wo ha onya typhoid first time na, the man e dro na, e betumi ye fi ha ye hu trace no wo ho. Obi so wo ho a, te say me say, ma fa dro na ewie, but I still have that trace there. Enti se am no gyan ye kwa na ye kwa typhoid test si a ye behu say wo. But because that other one is not showing positive, enti no, I don't have it. Do you understand? Thank you. Yeah, Bosu has a question for us.
So I would like to ask, what distinguishes between the use of the herbal medicine from the orthodox medicine in treating what was said?
You want the distinction?
Yeah.
Okay, so I always say that I will not pretend I know everything. I can only speak to what I know. So, for example, herbal preparations. We are using different combinations of leaves. Sometimes I know people use only neem tree. Others who will add prekese. Others will add some ginger, some, cloves and all other things. What I can tell you distinguishes the herbal preparation from the orthodox medicine is that for the orthodox medicine, if it is Cipro TZ that I'm giving you, I can tell you the active ingredients of Cipro TZ. That Cipro TZ has 1, 2, 3 ingredients in it, and wherever you go, it is like that. But for your herbal preparation, how can you guarantee that the first bottle that you got, it had leaves B in it, leaves D and leaves E? Can you guarantee that the second bottle you go and buy has the same ingredients as the first one? That is it. So I can vouch for you to use my orthodox medicine because I can trace the active ingredients. And regardless of where you are, irrespective of where you find yourself, you will be able to find the same ingredients in my orthodox medicine. But for the herbal medicine, I can't guarantee that. That is why as a medical practitioner, I will first of all recommend my orthodox medicine to you, because for that one, when you even come to me with a reaction, I can trace to know which particular ingredient is giving you a reaction. At the moment, we have a patient who is having a drug reaction, and we were able to trace it to which drug is causing that reaction. Because when we looked at his drug history, that particular drug that we gave was the new drug that we are giving. You understand? So for me, as a medical practitioner, I will advise that you stick to my orthodox. But in your own choice, if you want to do the traditional or herbal, you can still do that. So now do you get the difference? Thank you very much. Please, any further questions for me? Any more questions? So please, can I also ask a question? So with the knowledge that we've gained now, I want to find out how, as individuals in our various homes, we can avoid getting typhoid fever. It's an open question. Who would like to answer me? I think I gave it in my presentation. I just want to know whether we got a grasp of what I said. I'm saying that with all the knowledge that we've gathered today, I want to find out, as individuals, how we can avoid contracting typhoid from our various homes. How can we prevent that? Yes, madam. Please give her the mic for us. So it means she was listening to us. Yes, madam.
My name is Roberta.
Thank you.
Please, things that you can do to avoid getting typhoid. One is by doing frequent hand washing after visiting the washrooms, and then avoiding eating food outside, which you may know that where they've prepared the food is contaminated. So I believe these two.
Thank you. She has actually given us the basic. Okay, so Justice also wants to say something to us.
Okay, so I just came, but I would like to make a contribution. Anytime you buy any sort of fruits or vegetables from, the market, any place that is, you are not certain about the sanitation of the area, when you bring those things home, you have to make sure that you thoroughly wash them before consumption. That's one way you can also...
Okay, very interesting. Any further questions? Okay. Please let her give you the mic. We need your voice.
So can typhoid be transmitted from one person to another?
That is beautiful. Very, very beautiful. So when I started, what I said was that typhoid is usually picked up from our food. So for example, if I am the vendor selling the food and I use the washroom and I come back to selling the food without washing my hand, obviously I'll put it in the food, but you cannot get it. It is not sexually transmitted. Typhoid is not sexually transmitted. Otherwise, I'm sure a lot of people will be dead by now. It is not. The only way you can get typhoid from me is when I come into contact with excreta, which has the salmonella in it, and I introduce it into food which you will take. So, inadvertently, I have infected you, but not directly. It is through the food. You understand? It is not a condition you can get from contact. It is not airborne. Let's get that clear. Typhoid is not airborne. So sometimes you find people trying to avoid people when they have typhoid, especially in our homes. Initially, that's what we're doing. The only reason why you would want to avoid contact with somebody who has typhoid is, especially if the person is passing loose stools. It is very, very likely that the person may inadvertently pick and then maybe touch a plate or bowl. So for caution's sake, sometimes what we say is that in extreme conditions, avoid using the same cutlery set or plates and other things with the person, especially if the person is showing very severe signs of it. But otherwise, it is not airborne and it is not sexually transmitted. Thank you. You still have more questions for me? That's beautiful.
Okay. Assuming in a situation that you don't have water around, can you use sanitizer in place of water?
Okay. That also adds up. It adds up. So as much as possible, sanitizers also help. But water, I didn't say it. It is so So as much as possible, try to get water to clean your hands. But I know they've done some wipes too that you can use. So you can alternatively consider that as well. All right, so I take it that everybody is satisfied and would have less cases of typhoid fever, because I am concerned. Recently, we've had a lot of surge in typhoid fever cases, and we are concerned because in the long run, if we don't treat some of these conditions very well, which unfortunately is very common with most of us, we start the medication and then we end midway. It can lead to further complications, which we don't want. So I am hopeful that after today's talk, we have all picked up on what we can do to avoid typhoid fever, and we'll stick to it. Also, I want to encourage you that when you come here and you have questions that are beating your mind, the nurses are always available. I am there to answer your questions. If I can't, I'll refer you to a higher authority who can help you. Feel free to come to us. And when you come to Rapha Medical Center, one of the things I always say is that we aim at giving you the best treatments as much as possible. But we are human. If we do anything that you don't like, please tell us. Don't tell anybody outside. You come to us and tell us. But if we do something that you like, kindly broadcast it to everybody. And remember that at Rapha, it is always the healer at work. Thank you all very much and have a wonderful day. Thank you.
Thank you for watching this video. Kindly follow us on Instagram, TikTok, Facebook, and X at Rapha Medical Center. Bye.